It was hard to breathe. You felt like you were underwater. You just couldn't get comfortable, and just you couldn't get warm. It was just a constant state of feeling frozen.
David Schmidt has been in healthcare for more than 20 years. He knows severe illness, but this one, well, we'll let him tell it.
I had a temperature of 102, congestion, shortness of breath, achiness. It was probably the worst cold symptoms I've ever had in my life.
It was Thursday, and the chief nursing supervisor was meeting with the staff on the plan inside Suburban Community Hospital to use a brand new COVID treatment, a monoclonal antibody. The hospital had been designated as one of the only in the area to use the experimental treatment. But later, after the meeting, Dave felt sick.
I have a history of asthma. I'm 50 years old, so I kind of fit the criteria. I talked to our chief medical officer and our chief pharmacist, and we agreed to move forward to basically try out this new process, but also this new investigational drug.
It's a new drug, and I'm like, oh man, I'm doing this to my boss. Am I ready? But at the same time, what better person than the head of the organization to give that example of, hey, I'm using this, it's safe, I trust it. So let's give it a go.
ER Director Latoya Bonk was on the team to give her boss the drug. Mixed in an IV, it took nearly an hour to finish the dose. The treatment is a lab-made antibody. It's not a cure, but a tool to help the body fight off the virus. It won't mean you can skip the quarantine, but it can make people who are sick less sick while they're fighting off the virus.
We've been able to see the good and the bad. And when we see the bad, it's really bad.
That's one of the many reasons those who are on the front lines of this COVID battle say that they are grateful for any tool and help they can get in the fight. In Norristown, Deanna Durante, NBC10 News.